Everybody. Just a quick introduction, as Margot's already done loads already. I always get a good talk up from Margot. We work well together with the My Over 40 stuff, so we know each other quite well. Um, yeah, so I'm here to talk to you about the knee joint, as I said, and I have my lapel with me here as well. So I'll give a few kind of demonstrations or pointers as to where I'm talking about as well. Obviously not the knee, we know where that is, but when we're talking about the structures that are involved, I'll be able to kind of give you a look as to where I'm talking. Okay, so let me just start. As I said, I'm only in the door, so I get a bit flustered, so bear with me. Natural reaction, isn't it? Okay, so as you know, my name is Sarah. I'm a tutor and master trainer for ProFi Fitness in UK and Ireland. I teach several subjects, functional biomechanics, posture anatomy, physiology. They were different courses that are now combined. A lot of information in that, really interesting, especially the postural end of it. Because we're talking about joints and joint function, posture is going to factor a little bit in there as well. So the functional biomechanics course is a great one then to kind of give you a good intro and foundation in the knowledge that you'll need. Now, people will be here today with us that aren't students as well. The understanding of the anatomy of things on some level really helps with how we manage our daily movements, how we manage our physicality, our nutrition, everything that's come up in this conference so far. Education is always a good start, good place to begin. A little bit of knowledge, and then you decide what more you need to be able to function better or work better with that knowledge. So I'll give you a bit of information on what we're doing and give you a little bit of anatomy. So even if you're not in fitness yourself or you're not a student, it'll give you a good basis. I also teach mobility and flexibility, another course that is very important for functional movement, functional yeah, functional movement. Sorry, those little bleeps get me distracted. You'll hear them too. Okay, so mobility and flexibility, big factor in how our body functions. You need to have strength, you need to have stability, and you need to have mobility and flexibility. So there is another factor we're going to come across when we're going through this topic today. I also do my over 40. Margot might have spoken to you about it, and I'll be covering a bit at the end because my over 40 is a program that works with mobility and flexibility. And as I said, huge importance in how the body functions. So back to why I'm here today. I'm here today to talk about ways to improve your knee function, help reduce incidence of pain, really. Also, if you're already dealing with some knee discomfort or post-injury kind of recovery, that kind of stuff, there'll be a bit in here that'll be interesting for you too, I think. So that's why I chose the topic. It appeals to loads of different people, trainers and coaches, anyone who exercises, as we said, anyone who moves. Your body takes an awful lot. The knee joint takes an awful lot of the body weight because obviously it's holding up the body. That's what we would have originally thought with the stacking of the joints. Now I'm going to speak a little bit about fascia shortly, and when I do, you'll understand why I put stacking of the joints and the bone supporting the body in inverted commas there. It's a good analogy to help us understand things, but it's not quite as black and white as that, not clear cut, I should say. Okay. So we're talking about the knee. The knee takes an awful lot of the body weight in movements. If you're thinking about walking up and down the stairs alone, the knee joint has to open and close to allow that movement. So that has to be a fluid movement. It needs to be strengthened. It needs to be stable. I'm sure a lot of you at some point or would know of, if not have gone through it yourself, but a weakness in the knee when you're walking up or down the stairs. That can be quite common. Now, not after training, because we all know that jelly leg feeling where the legs don't feel like they're supporting you at all, but not that one. But general just structural tightness or instability that we might come across. And what's very interesting about that is there is a muscle at the back of the knee joint. I'm looking at it here. A muscle at the back of the knee joint crosses the back of the knee, and it's called the Popliteus muscle. And that is the muscle that opens and closes the knee, that allows that motion where the knee joint will open and close it. So it supports that movement then of walking up and down the stairs. So you might feel that bit of pressure at the back of the knee sometimes as well. When we're talking about it, there's a lot to consider, okay? There's a lot of ligaments, tendons, all that kind of stuff. So we'll have a little look at that as well, just so you understand a little bit more of what's going on in there. It's one of the most likely areas to receive an injury in your lifetime, depending on what you're doing. Okay, so you could, depending on your occupation, you could be prone to having ankle injury more, or shoulder injury. But across the board, because of that weight that we're putting on that joint, it's the one that's most likely to get affected for the majority of us, whether you're active or not. So as we said, there's so much that can go awry between the ligaments, tendons, cartilage in the knee. So it's a broad area of knowledge. So understanding the mechanics of it, the posture, the mobility, flexibility requirements, they can all help avoid and manage knee issues depending on what side of that you're on. So every one of us here, including myself, can benefit from better knee function, especially myself. I'm going through a thing at the moment, tight quads, weak hamstrings, postural, post-pregnancy kind of a hangover as such. That I didn't address, and that's quite common for a lot of us, that if there is a postural change due to injury or due to pregnancy or any of those things, that we don't normally fix them. We just kind of keep going and hope that it'll level itself out. Sometimes when there is a strain or a pull in a muscle, that can level itself out over time, it can ease. But when you're talking about a postural type issue, unless you address it by rebalancing the muscles and restructuring the posture, then it's going to be something that's going to have a knock-on effect. Again, when we talk about kinetic chains and fascia, I'll be able to explain a little bit more about that. Okay. So as I said, everybody here could benefit from better knee function or good knee function or improved joint mobility, any of the joints. When we, in our daily life, we don't use the full range of motion that's available in a joint. So with the knee, we're thinking flexion and extension, and that's the bending and straightening. This guy's got a hip issue. Bending and straightening of that knee joint. They're the main movements that are available at the knee, but also when the knee is flexed, when it's bent, you have some movement medially and laterally as well. So we're going to talk a little bit about the structures that are in there, what might be happening if there is discomfort. If you want to, if you simply want to prolong your independent moving and living, you'll need to know better how to manage joint movements, better improve your range of motion, how to limit the restriction in your flexibility. All those little things are going to come together to make it a cohesive kind of treatment or plan for your body. If you're an athlete, obviously the same thing, knowing how to work with your joints will help improve all aspects of training. So obviously if your knees and hips are working optimally, you're going to have a better run strike, you're going to have a better takeoff when running or swimming if you're using your shoulders. So athletes can very much benefit from this knowledge as well. It's good to have it. So factors that are important around joint mobility or joints in general would be mobility. That's the ability of a joint to move in its full range of motion, unrestricted. So that's what mobility is. Flexibility then is important as well. So that's the ability of the muscles around the joint to lengthen and come back to their correct supportive length. I'm keeping it as simple as possible without going into too much anatomical knowledge here because I don't want to scare anyone off. Okay. We also need to know about the stability of a joint. So it has to be stable. All of that is going to be helped by the mobility and flexibility as well. So once a joint is in its correct position, and then the structures around it are creating that stability, it's going to obviously be a more stable and functional joint. Then you need to look at the strength of the surrounding structures. So when I go into a little bit of, I'm going to demonstrate a postural issue in a short while, and that will help with the visualization of this. All the things that come together that make that function in the joint. So you're talking about muscles, ligaments, tendons, connective tissues, everything. And we can help that by our movement. So here's your small bit of anatomy then, okay, just a little bit. So you can see how many structures in the knee that can be affected in one way or another. And I'm not going to go into detail on this, but just so you get a bit of an overview. So obviously here's our skeleton. Let me pull him over and make sure you've got a good view of what I'm going to work with here. Back shot. There we go. Okay. So this guy, we're saying it's a guy, we're having a look at the pelvis here. From first view, I would say this is a guy. The pelvis seems a bit narrower and a bit deeper. Okay, and I'll explain that too. Right, so we have bones. We have 4 bones in the knee joint. You have the femur, the head, the main bone in the thigh. You also have the patella, which is this floating little kneecap here. Floating, it floats in your tendon that goes over the knee. Then you have the 2 bones of the lower leg, the tibia and the fibula. So they're the bones alone, so already a 4. Then we're looking at, these bones are connected by muscles, ligaments and tendons. There's 2 structures in there that act as cushions or shock absorbers as well. Okay, these sit between the femur, which is the big bone at the top, and the tibia, which is the big bone at the bottom. So it sits in there and protects that from too much friction, too much simple words won't come sometimes, but too much impact, that's it. So these structures help provide stability in the knee. So there's a medial one and a lateral one, as we said, between those structures. When either of them is damaged, you might have heard the term torn cartilage. So that's what they're talking about, is those meniscus or meniscus in between the bones there that are your shock absorbers. So that can cause an issue. So they're there to help, and we'll discuss shortly about how this happens then as well. So just to know that there's a lot going on in there. Your ligaments are like strong ropes, and they help connect those bones. They provide stability to the joints. So in the knee, there are 4 of those. I'm not going through every single bit, but you have a medial on the inside, a lateral on the outside, and then you have anterior and posterior cruciate ligaments. You'll have heard of those. Footballers often suffer. General sports people can suffer with the issues of the cruciate ligament, and that is the cross on the back or the front of the knee joint. So it's called cruciate because of the cross shape. So if you can imagine then, if those are crossed over each other, that they're creating a huge amount of the knee stability as well. So when something like that goes, I had a colleague when I worked in the gym, and she was huge into sports, and she tore her cruciate a couple of times, but she used to teach her aqua aerobics, and had to absolutely stop everything and go on crutches when those cruciates went. It's not something that goes first. There's normally some sort of a sign that it's common, tightness, restriction in other areas, because as I said, those are cruciate ligaments, yeah, are strong rope-like structures. So if they're going to be damaged, there's going to be little signs. Now, as with everything, we tend to ignore those signs of discomfort or pain, because we kind of hope they kind of edge away on their own. They do their own thing and they disappear, and we just keep going and hopefully it'll go away. But in general, when we're talking about ligaments especially, those ropes are not going to be healed without some sort of a proper recovery structure. So then you have your tendons. Tendons then connect your muscles to your bones. So you have the quads in the front of the leg. So the strong quadricep muscle one of the biggest, strongest muscles in the body. It is on the front of the thigh, and it covers the top of the patella, this floating bone in the knee. And that's the quadriceps tendon. So a lot of things kind of start to make a little bit of sense once you know the muscle, you know the bone. There'll be a patellofemoral syndrome as well, and you'll be able to break down patello is patella and femoral is femur. So there'll be something between the patella and the femur. So knowing your basic anatomy helps. This guy is standing on my knee here. Okay, so that patella tendon goes over and goes down into the quadriceps tendon goes over the patella and down into the patella tendon. So they in turn attach to the front of the tibia. So everything is connected. There's a chain of these connections and connective tissue. You have your hamstrings on the back. That's a big one. Hamstrings for people, we'll talk about it in shortly when I talk about posture. But hamstrings for people who stand a lot or sit a lot tend to be the underused or underworked muscles, and they end up weakened and lengthened and give a little bit of instability to that knee and hip, but we'll come back a little bit more to that. So you have main muscles then that flex and extend. So to flex is to bend. If you think flex your bicep, you're shortening that angle at the joint. So to flex the knee would be to shorten the angle, shorten the angle at the hip. Flex the knee, bend it, and then the muscle that does that, is your quadriceps at the front, and then the hamstring muscles are the muscles that bring the leg up the back. So when we're running or going downstairs, an awful lot of quad action there, depending on the how you plant your feet, of course, as well. So there's a lot of, when we talked about the kinetic chain and the fascia, which I will describe, everything is connected in one way or another. Nothing is acting in isolation in the body. So then you have bursa. You might have heard of bursitis, what they used to call housemaid's knee or clergyman's knee. It's just different parts of the knee joint that are protected by fluid-filled sacs, and they get inflamed. As you can imagine with housemaid's knee, it's that terminology came from women scrubbing floors on their knees, so housemaid's knee, and that's the inflammation of the bursa around the knee joint. So lots of structures in just the knee alone, and as I said before, it's a chain effect, it's a chain reaction. If we were to focus on the knee joint or knee joint alone when dealing with movement or injury, we'd have to take into account all those structures. And that's if we were isolating that assessment or that recovery or that awareness. But you don't, because nothing acts in isolation. What we need to do, or how I would approach it, I should say, because everybody is different and everybody has their own methods. Once the end result is reached and we do it safely and with knowledge, then your process is your own. But for myself, I'd be establishing are certain muscles overactive and tight, or not are they, which of them? Which of the muscles are overactive and tight? Which muscles are underactive, lengthened and weak? And that's in someone with a natural postural issue. If it's somebody who has been training in the gym, and they may have created an imbalance in their muscles, and then changed posture because of it. So there's a little assessment to do as you go along with each of those things. So for somebody who's a bodybuilder or whatever like that, you could be talking about purely, you've seen it yourself, what you can see in the mirror is what you work, and what you can't see you forget about. And that can be a simple little reason why you would have a postural issue or an imbalance as a bodybuilder, as someone who's into fitness and training. When you're a runner, if you tend to heel strike when you run, and I'll come back to this shortly, I have a little bit of tips and tricks from a friend of mine in Foot Solutions who's been very helpful with how shoes can help posture. But if you're talking about your foot strike, that can change the alignment of the knee and change the strength, that change which muscles are activated to propel you in that certain situation. So everything from the feet up to the knee, and we're talking about your stacking of joints. So you could look either direction, again, as I said, up to the person dealing, but you'd be looking, right, you have your knee joint in the center, but the function of the hip joint is going to be a huge factor too. The function of the ankle joint, the foot, all of those things may be an impact on that knee joint as well. So it's just like if you are a personal trainer and someone comes to you to lose abdominal weight and they don't have any understanding necessarily of the, I don't know, the mechanics of fitness or weight loss and all that. Generally what you'd be asked first is what sit-ups or what exercises will tone this area. So they want to work on the area that they've come to you to work on. So when we're dealing with things like posture here or knee joint problems and issues, you would want to look at the knee joint and around that structure, the connecting muscles, so that person that you're working with can see the train of the process of how you're going to deal with them. Very often though, when we have tension or tightness in the back of a knee joint, working on the sole of the foot can be a huge reliever. But if you were to take your client and they come into you with a sore knee and you give them a ball to roll their foot over, they might be thinking, okay, this person doesn't know where the knee is. And that's quite common as well. So, you know, you need to give a little bit of what the client wants and needs, but also use your knowledge to address the fact that these things can be coming from further away in the body. It can be more distal. And then as a client, just to be aware, if you're here and you're someone who's interested in fitness but not a trainer, which is wonderful to have you all here, great to see everybody. It's good to have an understanding that your trainer might know that this chain is affected in a different place. It might start there. So that goes to say, same for toning the tummy. We might get you to run up and down the street, not literally, but you might want to do sit-ups. So best option for me as a trainer would be to do a bit of both. That way then everybody's happy and hopefully we get to that end result together. Same with the knee joint, same with any joint movement. A lot of people may not consider that they'd have a postural issue, or we have this traditional kind of understanding of what posture is, as I'm sitting here in seriously bad posture. I remember my mother or my parents would have, you know, put the shoulders back, chest up, sit nice and tall, you know, obviously not like an instructor would, but your posture was that. It was you're sitting up tall, shoulders back. So when we think of posture, we're often restricted in our knowledge of it and think, okay, let's say I'm not standing properly. Whereas it could just be, like I said, your muscles are being pulled on one side by a tightness, they're weak on the other side and lax, and that's shifting your posture. So those things can be addressed. When we're looking at, I'm just thinking of my teenager right now, I think we're going to have an awful lot of cervical curvature in years to come, and that's the top of the spine. My daughter sits leaning over her phone. We all do, I do, and now we say it's a modern issue, but if you think about it, a long time ago people used to lean over their newspapers, you know, so it's not a modern issue. It's just this is how we oldies work it. We like to give out to the younger ones and say, well, in our day. So posture, we have a definite kind of an idea in our head of what that is. So just be broad-minded about it, that if you're going to your trainer and they're saying we need to address your posture, you don't need to go around walking up tall the whole time. After it, it might just be a little bit of balancing your exercise. Okay, so let's take, when I said that certain muscles are overactive and tight or underactive, lengthened and weak. Now, sometimes it takes a little bit, it's like a puzzle trying to figure out what that means and visualize it. When we're thinking, I'm going to stand up and show you actually what I'm talking about here real briefly, because I think we're going to come back to this again in a minute. I'm just going to move my screen. Bear with me. Okay, so for example, oh the noise, sorry. So for example, when we stand normally or properly, you're talking about a neutral pelvic tilt. Okay, so when I stand, my pelvic tilt is anterior. I have this kick up at the glutes at the back. It's not intentional. I'm taking it from when I was pregnant, that all the way to the front, pull the body forwards. So here was my lovely neutral posture, and then the baby. Did it all, not me. Pull the whole body forward. As you can see, my glutes are starting to pull up. My lower back is contracted. So this muscle, bear with me here. This muscle here will be shortened. These muscles will be lengthened and weak because I'm not working them to contract and bring it back into proper posture. So lengthened and weak at the back, glutes lengthened and weak. If I'm not training, you're looking at core at the front that's going to be compromised. Even though it's lengthened, it needs to be strengthened again. The whole thing needs to be reset. But why I'm mentioning it is if I tilt the hips, my quads contract a little bit more, and this is my posture, not that I'm actively tilting my hips, but the quads contract more. They pull on my knee, straightens the knee joint even more, so puts pressure on that knee joint and creates kind of a hyper extension, which is what I have on one side of a hyper extension. But so that knee joint is now impacted, pushed into that straight line position. So when we say your joint should be stacked, yes, but obviously there's a certain amount of curvature in your joints, especially your spine, to make sure that that isn't a direct straight line like a pole. And when those quads pull, they're going to pull it nice and tight and all that direct force down onto the knee joint. So that's just one of the possible changes that can happen in posture that happen to a lot of women that have babies. And that's just that one little area of clients or people that we're talking about that can be affected. I think I had a question pop up there. Bear with me a second. I have chat coming up. Am I going to cover supplementation for the knee, wrist, and joints too? I don't do nutrition. If you saw, I'll explain. If you saw our instructor yesterday, Peter, I think I may have a head like a sieve. Someone will tell me now in a second. He was fantastic. You need 4 years of education to be a nutritionist. I can give you advice. I can explain to you what I do. I can do all of those things, but I would never be Peter O'Halloran. Thank you so much, Aaron. Students always saving my skin here. So that was Peter O'Halloran. Look him up. He's on Instagram. He was fantastic yesterday. If you didn't get to see him, I highly advise going back and looking at the recording when it's sent out to you. It'll be sent out, I think, Monday. But he goes into so much stuff about nutrition, and you wouldn't listen to my advice after because I'm not a nutritionist. Honestly, I take supplements. There are different, obviously the oils, the cod liver oils and that kind of stuff are great for fluidity in your joints. What I deal with is movement. Who else is great is Siobhan, our nutrition instructor. She'll come in as well and she'll be doing some of our courses. So definitely look into it. If you want to know more, research for yourself, study it, because it's a huge benefit to know about your own nutrition. It's something you can use all the time. As I said, I'm a lover of knowledge, so I just tell you to go and look it up and search it for yourself, because that is genuinely where you get the best knowledge. Listening to different people, different opinions on it. Okay. Yeah, that was just one question. Okay, I'm going to come out of that now so don't distract me. So yeah, so the posture of pregnancy and little things like that can put an awful lot of pressure on those joints. That's just something to be aware of. We have a pregnancy course coming up actually at the end of this month, if it's April. And I'll cover a little bit of that in there too. So good to have information if you're an instructor on how to manage those kind of things. Not just posturally, because we're talking about function. during pregnancy, and how you can do exercise and all that. Okay. But if you had an awareness of that, and if I had an awareness of that when I was actually training when I was pregnant, I might have been more aware. Generally, I would have been more aware. So my education from fitness and pregnancy was after I was pregnant. So, you know, sometimes it takes something happening in your life to make it relevant. So with me, I have this knee issue. I try to walk down the stairs and I'll have a little bit of a wobble. Running can be an issue. And what's worse is knowing that you can fix it, but also being the one to have to do it. It's nearly better to be able to go to an outsider and get them to tell you exactly what to do and you follow it. As an instructor, I'm sure some of you will know the hardest programs to follow are your own, or else it's just me being lazy. Okay, so what we were talking about there. So when I was standing, I was showing you the hamstrings are lengthened, but they're weak, right? Often when we have that posture and we have that feeling in the hamstrings of lengthened, when we don't understand fully our own body, that can feel like it needs a stretch. The instinct is to want to stretch it, okay? But consider this. If the muscle you're stretching is already lengthened and weak, it's possible then that rather than helping the situation, you're hindering it, or you're adding more strain to a place that's already under strain. Okay, so at the moment, I have a client who has pain on the inside of her hip, was how it was described. And after investigation and talking to her and observing her movements, we came to, now, before I go any further, it's all trial and error as well. You are 90% sure that this is what's the issue, and we'll work around that and see. And then if that don't work, I'll know what to do next, because there's that chain. So with this lady, what we established was that there was a tightness in the hamstring from the under the glute, so that sits bone. If anybody is a yoga instructor or Pilates instructor, you may have come across this injury. Yeah, injury, I suppose we call it. What is it called? Oh goodness, something high, something tendinopathy. Sorry, when words just refuse to come to my mind. But the point of it is that it's a pull in the hamstring, in under the bum where the sits bone is. And if you think about where you sit, so if you're not an instructor and don't know the sits bones, just where you sit will give you an idea. So this lady thought it was the inside of the groin, because that's where the pull felt like it was coming from, but it was actually the hamstrings. So if we were to stretch, first thing she would have wanted me to do was stretch the inside of the groin, because that's where it felt like it needed it. But it was already pulled and weak up at the back here. And if we were to stretch the connecting structures, we could have caused more damage. Now, light stretching with movement is okay, but we're not talking about increasing her flexibility. So we wouldn't want to put that extra strain on that adductor, which would have close connection to the hamstrings then, which would then put more strain on the hamstrings. So she would have ended up in a worse off position. So once we assessed that it was coming from the hamstrings, we knew that there was high hamstring tendinopathy. That's the one. They always come back in the end, the words. It just takes time. That kind of thing needs to be rested to heal. It's a tendon that's after getting inflamed or somehow impacted. There could be, you have your piriformis muscle going over your sciatic muscle back here as well. So if we had to continue there, it was possible that stretching and pulling on that muscle could have actually ended up with now what she thinks is sciatica on the outside of the leg. So you really do need to know a little bit of about what's going on in there to be able to help your clients. that's a huge part of why anatomy is important as instructors. Um, Sometimes in the moment we don't take in how important it is. It's later when we're doing things like this and we're going, right, okay, let's put this together like a puzzle. There's a pain over here, but it's I can feel it down over here on the inside of the knee. Then you need to know what muscles connect to where. Is there an attachment to the bone? All those little things are going to give just that little bit more information and feedback. So for that lady, we needed to rest to get ease out of that high tendon, high hamstring tendinopathy. See, just got again. Rest it, but then we need to strengthen. Later on, when it's after recovering, there's a weakness in the hamstring. It's being pulled from the front. I would start by looking at strengthening the hamstrings, adding a little bit of flexibility at the end. Sorry, stretching, not flexibility. Uh, the difference being stretching is the time we take after exercise. This is how I would describe it, not how it's written in the book, but just to give you a visual of it. Stretching would be what we do after exercise to return the muscles to their normal structure. Okay, very loose. Whereas flexibility is progressive. Progressive. My instinct there was to say lengthening of muscles, but that isn't the case. What you're actually doing is working with the nervous system and allowing your nervous system to access further flexion. All right, let me pull that right back. We're talking about flexibility for function of the joints. Okay. We need mobility of our joints. So we need I'm going to move up a little bit higher to show you now, because when we're speaking of joints, for any of the joints are going to have the same kind of pathology to them. You can relate this to the knee as well, but I'm just going to demonstrate with the hip. First of all, it's eye level and easier to show, but we have a certain amount of movement available in each joint. For the most part, possibly as kids, we use a good lot of that. You know, when you see babies squatting and they have their knees up around their eyebrows and all that, you know, they just move a lot freer and easier. So they're obviously using more of that joint movement. And as we get older, then we start to restrict that movement in some way, whether it's to do with our occupation, how we stand, whether it's to do with the type of fitness that we prefer, or whether, you know, if you're an athlete, you're prone to a certain type of movement. What happens is there is that whole other area of the joint that's not getting worked or used. The area that is being used is going to be under more friction, more tension. There's going to be wear and tear an awful lot more. The part that isn't being used, and when I said fascia, I'll explain that to you now, but the part that isn't being used gets kind of compacted in this fascia and restricted. So it's just like, I'll describe it shortly, but it gets restricted basically. It can be moved, it can be eked out, it can be helped, but it's going to take process. It didn't happen overnight, so it won't be fixed overnight. And that's another thing that I think most of us fall victim to, quick fixes. We really want to be fixed quickly. And for the most part, a lot of the things that we need fixing didn't happen overnight. So they won't return to some sort of normal or better function overnight either. So fascia. This is very interesting for everybody to understand. It's something that practitioners and trainers and professionals, say for example, would only be aware of in the last decade or so, which is crazy. So we all know pictures of anatomy and how we see the body in anatomy books, that the muscles are structured. You can see the definition of the muscles in the body. Everything is lined out and clearly separated. But in fact, the body doesn't work like that. You don't have little spaces in between everything that just nothing is there. What you have is connective tissue, and it's fascia is what we call it. So you might know of different types of fascia already without being aware of it. So we understood as a beings that fascia existed, but we didn't understand it was a whole body structure. So it's one of the biggest structures in the whole body, covers everything from the top of your head to the tip of your toes and everything in between. It goes in between all your organs, ligaments, tendons are part of it. But if all of that structure is connected, that's where that chain comes from. That's where the working on the sole of the foot, when we're talking about knee issues, can be a factor, because the fascia can be tightened in one place, but the referral of the restriction can be somewhere else. So like I was saying with the, say for example, the hip joint, when I said earlier on that the friction happens where the repetitive movement happens. For example, now I'm being very loose here on just to give you a visual, but for example, then you're talking about a laying down of fascia. So what we're talking about, visualize like a cobweb, very strong, very movable cobweb. But cobweb in a room, we don't clear it away, we don't move, we don't clear that cobweb, more lays down. And the more that lays down, the more solid that structure. Now it can still be maneuvered and made to work better, but obviously the longer it's left to sit, the longer it's left to solidify or hold in that position, the longer it's going to take us to work out of it. So again, look, everything is, it's possible. Babies can do little squats and hit their little bum off the floor. As I said, knees up around their eyebrows, not a bother to them. And we could be able to do the same, but we haven't been training our whole lives to do that. What we've been training our whole lives to do is stand up, don't move your hips, you know, all those things that are causing us those restrictions. So just to, as I said, fascia is something to be aware of. If you have an interest, there is a huge amount of education out there to be had on it. It's as I said, new in the medical field. So, you know, exploration is still there, and it's great to be in on the ground floor of these things and see how it changes. What's great is I heard a quote the other day, and I bet you I won't say it properly now, but I think it was Gandhi, so I definitely won't say it properly. I'm going to do this man a complete injustice, but that's if I don't lose my train of thought. But now I'm going to have to look it up. Damn it. I'm going to come back to Gandhi's quote shortly, because it is relevant. Believe me. Okay, stay with me for that. That'll be the interesting thing right at the end. What was Gandhi's quote? Right. Going back to posture. Here's me writing down Gandhi's quote. So I can look it up for you later, because you will want to know now after creating that need to know in there. Okay. So the takeaway from what I'm saying is, when we are trainers, and we're dealing with clients, what we're looking for, we want to observe the posture for cues. Again, it's not the only feedback we're going to get. Sometimes it's very difficult to tell by looking at someone or looking at their movement where the restriction is, especially for those of us who would be earlier in our education. The longer you spend at it, the more you see, obviously, the more you recognize. So, you know, take your lessons as you go and learn from them. So if you see something, you come across something like this, generally your instinct as a trainer is to go, oh my God, I don't know if I'm qualified to deal with that. And that's a good reaction, because you don't want to hurt anyone. But don't be afraid to go and investigate. Stand beside the person they are going to learn from. So the next time you can see that process yourself. You know, you need to experience these things often to be able to understand it for yourself. So we're observing posture for clues. Sometimes the gait or how someone walks can show us as well. You remember your mobility, flexibility, stability, and strength. So there's 4 pillars for movement. We often look at strength. Strength is big. Your muscles are strong, your body functions well, but they need to be mobile, they need to be flexible, and they need to be stable. All of that can be done in your training quite easily once you're aware of it, and once your trainer is aware of it too. Pay attention to both sides of the body. So if you have issues in the hamstring on one side, you're going to Now I'm saying you, this is obviously very general. Some people will, some people won't. For the most part, they will. If you have a pain or a strain in this hamstring, you're going to compensate by shifting the weight of your body off of this side to the other side. So where is the next place going to be hit? The other side of the body. Generally, we'll see that. So if somebody has knee problems on one side, even if they go for surgery and they get that sorted, while that's being rehabilitated and sorted, the other knee is after taking so much of the weight and the impact of the body that now that one needs to be addressed. Not always to the same level, not always surgery, but you will need to look at the flexibility, stability, mobility of the joint that's not sore as well. So why not work on both as we go? So rather than being reactive, we can be proactive about it. Um, yeah, so imbalances in the body can create a little bit of wear and tear on one side more than the other, and then it can lead to both sides. Um, okay, so as you know, nothing in the body works in isolation. If we address the knee, we need to look at where the strain or imbalance is coming from. Hip function is going to have a big impact on that. Like we said, I'm going to go quickly into this next. As I was late by 2 minutes, I have run over myself here, but not to worry. This is the important takeaway from this. I'm going to finish up with that. But before I do, women's hips, right? When I said earlier on, this guy is a guy. Women have wider and shallower hip basin, or pelvic basin, I should say. That also leads to an adduction at the inner knee, so the legs kind of tend to come in at a slight angle. You'll see this if you're a trainer or an instructor when you ask women to squat. If they haven't been taught how to squat correctly and you just leave them show you their postural movement, you'll often see that the knees drift. And that can be a factor because of the placement of the hips, the alignment of the knees, and it's again awareness and training. It's not that every woman out there is going to be knock-kneed going around. You know, it's just something that we need to be aware of. There's a difference in the anatomy that causes an impact for women. And as trainers, we should know that. Okay. So before I finish, I want to go on to a few little bits. I just want to scan here. I'm after writing down something that the chap from Foot Solutions I was talking about, Peter Jones in Waterford. Foot Solutions work with your shoes. They check your gait. They do tests to see if you have arch issues, all that kind of stuff. There's a lot more involved in it than we would take credit for or take understanding of. Again, unless you've been there and needed it, it doesn't seem like something that would be of use, I'd say, to a lot of people. But genuinely, there's a lot to be learned from how your foot strikes the ground, how your foot is functioning, whether you have a high arch or not, are you wearing the correct shoes? All of those things are going to impact on your knee as well. Okay. So do's and don'ts for helping your knees feel the best. Don't rest too much. So we want to find that balance between movement and resting. If you rest too much, you can weaken your muscles, and that can lead to worsen your joint pain. But also you're limiting that mobility, limiting that movement, and that obviously is going to have a knock-on effect. Do exercise, so strengthen the muscles that support the knee and increase your flexibility. So you do need to move. You do need to make all those muscles work in balance. When we walk and we only walk, we're literally working the quads. Those hamstrings are going to be a little bit weaker, depending on if you have that kick up at the back. Again, it's about how you walk. Don't risk a fall. So this is for older people. If you have a painful or unstable knee, it can make a fall more likely, and that will end up causing more damage. So obviously the impact to a knee joint that's already injured will be a bad thing. So lighting in the house, railings on stairs, that kind of thing. Your RICE. So people talk about RICE: rest, ice, compress, and elevate. So that's generally when people have inflammation, they would use RICE. It's good for minor injury. just after injury, or if you have an arthritic flare. So people wonder when to use ice and when to use heat. For joints, we're talking arthritic flare, use your rice. Inflammation like your bursitis, you can use rice there as well. Heat I would use on your muscles, and then before you would exercise, just like your warm up. Again, that's personal preference. Okay, so this is the one. Don't let your shoes make your matters worse. Okay, so this is really important. As we said, your kinetic chain is there. Your feet are the base of it. So if that's not set correctly, then you're going to have a knock-on effect. Cushioned insoles can help. They can help reduce the stress on the knee. So as I said, I work on a referral-based system with Peter Jones from Foot Solutions in Waterford, and I was asking him what kind of advice they would give. And he was saying that generally when it's runners, as in people who run, not runners on your feet, the most common advice they'd give is to look for a shoe with a decent, strong heel counter. So it should have a stable shank, which means it wouldn't be too bendy in the middle, and flexible at the forefoot. Now, you wouldn't expect that much information just from what shoes you wear. And if you're a runner, you're going to want to know this as well. How to make the impact on the knee joints less. Go to somebody who can give you a good prescription for shoes. They're not going to be prescription shoes like we would have imagined before with the little lips in them, but you know, they're going to be the ones that work for what you need. If you're a heel striker, and most people are, runners are made out of EVA, and they compress and collapse on the lateral side, that's the outside, after about 400 miles. So depending on how heavy you strike, how heavy that foot strike. And when you get compressed on the lateral side, that could be problematic, put stress on the ankle, which brings stress to the knee, the hip, and again, knock-on effect there. So sometimes, even though we're moving, we need to be aware of how we're moving. Are we doing it in the most protective way for our joints? Are we using all the tools at our disposal to strengthen and make that joint as functional as possible? And they're your 4 pillars we spoke about earlier. Expert advice to finish on. What's very important, if you have new pain of any kind, get a doctor to check it out. You need doctor's clearance before you can go to your personal trainer, before you can go to your physio. Anybody is going to want your doctor to say, yes, this is something that needs to be looked at before you do any more damage. So get your doctor's clearance. The doctor may give some sort of indication as to where they suspect or know the issue to be, and then your trainer has a definite plan of action or a place to work on with you. Again, obviously make sure you choose your trainer that has the experience and qualifications in it. As we saw, there's so many different things going on that just knowing your exercises sometimes isn't enough. You need to know a little bit more. Okay. So that's the main part of my talk for today. I'm just going to have a look and see on chat. Tracy is saying hello and goodbye. She had to shoot. Tracy, thanks for joining us. You'll see this on your recording later. Okay. I'm going to pause there for a second. I'm going to keep my lovely face on the screen because I make lovely pause faces and you can watch those. And I'm going to look up Gandhi's quote because this will drive me crazy. While I am, just to be aware of the fact as well that you might have seen knee taping and knee strapping. On my own Instagram, I put up a post there, I think a week or so ago, where I had taped my knee with kineso tape. It's something I would have done when I worked with the cyclists on the Ross, the On Post Ross. They would have had to cycle for days on end and with little niggles and injuries and have to progress through it. So taping and strapping is also quite useful for athletes, or I suppose we see it more commonly now. Every day we might see someone running on the road that have the kineso tape. That would be the different multicolored tapes that you'd see. So that's another type of training you could do to help with your joint stability for your clients. We spoke about the nutrition involved earlier on, the supplementation. Again, there there are so many things that claim to do one thing, whether they do or they don't. There's going to be research on the internet to back up either side. So investigate for yourself, trial and error with those kind of things, but definitely go and see your nutritionist. Peter or Siobhan there will be able to help you on that too.